Medical certification of cause of death is what we usually receive from the doctor after the death of a person. It should contain all the information to make us understand the cause of death. But many a times we feel disappointed because we see some of the diseases in the standard certificate are left vacant or the disease names does not match the prescribed standards, and it is not uncommon the coroner's office turns it back to rectify those contents. Above all, I have observed that many discrepancies and different viewpoints among the doctors which does not comply with the standards prescribed by the WHO. Hence, to understand all about cause of death certificate and end those confusions, I contacted renowned forensic pathologist Dr. Dinesh Rao. Dr. Rao, can you please explain what is meant by cause of death?
Cause of death are those diseases or the morbid conditions of an individual, or the injuries or the violence which has resulted in death or which have contributed to death. So there may be a combination of those morbid conditions or the diseases which are directly resulting in death or which are indirectly contributing to the death. So all these things are cause of death of an individual. Or it also includes the circumstances which produces those violence or the injuries. So all this we consider it as a cause of death of a person.
Now first let me ask you as to who should author the cause of death certificate, and can you explain why is it so important?
Yes, the most important thing is why this cause of death important? Why the certification itself is important? This is something which majority of the individuals don't understand, and they should always try to remember whatever the health policies or the health programs or the preventive programs of many diseases which have been implemented by the health ministry or the health department of a nation. Their policies and the programs are entirely based on those statistics which are as a result of those cause of death certification. That means all the terminologies which you used in the cause of death certificate, it is based on those statistics. These health policies and the health programs are derived. So now you can understand the importance of these particular cause of death certificates. So it is very vital that these particular terminologies which you use are an appropriate cause of death certifications or a certificate with all adequate information. It is very vital for any nation. It is because of this particular information, the health programs, health statistics, and more importantly, even the research programs which has been derived from those statistics, it adds enormous implications on the health programs or preventive programs of any diseases, or to understand the disease process of a region. It is based on this particular statistics or the information provided by the cause of death certificates. And above all, the person who need to issue this particular cause of death certificate, or the person who need to author this particular cause of death certificate, it is very vital, and it is more important to understand that only a registered medical practitioner can issue the cause of death certificates. And that registered medical practitioner is the one who has examined the deceased, or who has examined the patient within 14 days of his last illness, or he is the person who has admitted the patient, or he has admitted the deceased in his medical institution. So he is the person who will be responsible to issue or to author the cause of death certificate.
Can you please explain us how a standard cause of death certificate has to be?
See, any standard certificate of cause of death certificate, that has been prescribed by the WHO, and it is our duty to honor the standards as prescribed by the WHO. So each cause of death certificate, you can see, apart from those preamble of the certificate, where apart from the particulars of the deceased, the more important is the part 1 and part 2 of the cause of death certificate. The part 1 contains the information pertaining to the immediate causes of death, the antecedent causes of death, and the very important part of the part 1 of the certificate is the underlying causes of death. The part 2 of the cause of death certificates contains all the informations which are all the diseases, the morbid conditions or the comorbid conditions or the injury process or any other factors which are directly or indirectly responsible to those causes of death. All this will be included in the part 2 of the certificate.
What is meant by underlying cause of death and explain its importance?
See, the most important thing is, yes, in part 1 of the certificate, cause of death certificate, is the underlying causes of death. See, underlying causes of death are those diseases, are those morbid conditions, are those injuries, are those violences which initiated all the antecedent process or the terminal process or the immediate causes of death. So, it is these conditions, these diseases or these morbid conditions which trigger the other factors like the antecedent factors which resulted in death of the persons. So this is the very vital aspects in the statistics are concerned, because most of the statistics is based on the underlying causes of death. So it is this underlying causes that should be very appropriate and it should be totally adequate, and this particular information has got the larger importance in this statistics and the framing of the health policies of any state or the region or a nation is concerned.
What has to be written in the column immediate cause of death, and what is meant by antecedent causes of death?
Coming to the antecedent and the immediate causes of death. The antecedent causes are the one which were the result of the underlying causes of death. So because of the underlying causes of death, the antecedent causes did arise. And these antecedent causes were the one responsible to the immediate causes of death. That means to say, these immediate causes of death are those diseases or those morbid conditions which were present at the time of death or which preceded the death. So they are those, we call it as immediate causes of death. And all other conditions which were there before the preceding causes of death, we call it as underlying, we call it as antecedent causes. And all those antecedent causes and the immediate causes were as a result of one main particular diseases or a morbid conditions, and that we call it as an underlying causes. I hope this will be able to for you to understand, and I think I would just give you examples to understand this particular immediate, underlying and antecedent causes. For example, a patient who has aged about 70 years, weighing about 110 kilograms. He came with a history of chest pain to the emergency department. And he was treated for nearly around some 1 day. And during this course, the doctor was evaluated the patient and he was able to conclude that the patient was having chronic hypertensive heart disease. He was having atherosclerosis and he was having a left ventricular hypertrophy. And then suddenly just at the terminal phase and before dying, he developed myocardial infarction. And that was due to a thrombus in the left anterior descending artery. And he was a known chronic alcoholic and he was a known smoker since nearly 15 years. So given this particular example, now let me frame the cause of death, or let me understand the underlying and the other causes. So in this, the immediate causes of death is the one that is the acute myocardial infarction, and that is due to a thrombus in the left anterior descending. So that we designate as the immediate causes of death. The antecedent causes are one where the atherosclerosis, the left ventricular hypertrophy, and all these things were the result of the hypertensive heart disease. So now, in this particular case, the hypertensive heart disease will be the underlying causes, and it is this particular morbid process which trigger the atherosclerosis and the left ventricular hypertrophy. And this was responsible for the thrombus in the left anterior descending of the coronary, which caused the acute myocardial infarction and death of the person. I think this particular example would be for you to understand the underlying and the antecedent and the immediate causes of death.
What is meant by contributing causes of death, as specified in Part 2 of the certificate?
Now the contributing causes of death, that is Part 2 of the cause of death certificate. In these contributing causes, it is very important to understand that these are those morbid conditions, these are those disease processes which directly contributed to the cause of death or indirectly contributed to the death. For example, if you take with the previous examples of the myocardial infarction, in that I have mentioned that this particular individual was a known alcoholic, he was a smoker, and his weight was 110 kilograms. That means to say the obesity, the chronic smoking, and the chronic alcoholism. All these things have contributed to the hypertensive heart disease. May not be direct, indirectly. For example, obesity may be directly, but the others may be indirectly. So, these are the factors which we cannot afford to ignore. That is the reason we include those factors which may not be directly or responsible, but have contributed to the death. Considering that, since it should not be left aside, this should be included in the cause of death certificate, but in the Part 2 part. So that is where we fill up this Part 2 part of the cause of death certificate. That is factors which are directly or indirectly contributed to the death.
Is the time interval mentioned in the standard format is important, and please explain as how it is measured.
See, the time, I think in the cause of death certifications, I think apart from this antecedent underlying causes, on the right hand side, what we see is a time interval been mentioned. So this is another very important documentation which helps us to understand the underlying antecedent and the immediate causes. For example, in the immediate causes are those conditions or those morbid conditions or those disease processes which the interval between the onset of those disease processes and the termination or the death. The onset of disease process and the death, and that interval, the shortest the interval will be the immediate causes. The more the interval, that will be the intermediate causes or the antecedent causes. The longest the time interval will be the underlying causes. I hope this particular time interval will make you understand the underlying, or will make you understand to differentiate between the underlying, the antecedent and the immediate causes. Antecedent causes will also be called as intermediate causes. So going with the examples which I had given in the past pertaining to the hypertensive heart disease, the individual was suffering from hypertensive heart disease since 10 years. The atherosclerosis and left ventricular hypertrophy was suffering since 7 years. The acute myocardial infarctions, the thrombus, that was hardly for some 30 minutes. That means to say, the lesser the interval, that is 30 minutes, is the immediate causes of death. And the more the time interval, that is 7 years, that is the antecedent causes. The longest time interval, it is the hypertensive heart disease, that is nearly around 10 years. So that will be considered as an underlying cause. I hope now you understood the importance of the underlying causes, the time interval. And that will make us to differentiate between the underlying causes and the antecedent causes and the immediate causes. So that is the reason the time interval has to be mentioned, and this time interval is the interval between the onset of the morbid condition or the disease process and the death, or the examination of those particular morbid conditions.
Lastly, Dr. Rao, going with the present pandemic, COVID-19, can you please explain us how COVID-19 in the death certificate to be documented?
So this is something which I usually get questions from, queries for many of the practitioners. As such, there should not be any confusions with this COVID-19 deaths. The reason being is, the COVID-19 deaths is the one is the one which occupies the space of the underlying cause of death. So because this COVID-19 deaths are the infection of coronavirus COVID-19 was responsible to the terminal causes of death, and that terminal causes of death based on the research, it has been well known, either it is an ARDS or acute respiratory distress syndrome, or it is due to a fulminant myocarditis, or it is a disseminated intravascular coagulation. So based on those particular conditions, you can put the designated intravascular conditions or ARDS as immediate causes of death, and the antecedent causes, if it is there, you can document it, or if not, you can directly enter the underlying cause of death, and that underlying cause of death will be COVID-19 only, or the coronavirus. So I think this ends the confusion, but in this particular coronavirus death, COVID deaths, you should understand that the contributing factors are very essential. That means most of the deaths, as you know, it has been observed in the individuals who are senile individuals, who are hypertensive, who are diabetic, or who are suffering from cancer or any immune deficiency individuals. So that will become factors which are directly or indirectly contributed to death, and that will be part 2 of the certificate. I think COVID deaths will be a classic example for you to understand how the certification need to be given, or to understand the cause of death of an individual.
Dr. Rao, with all your information and experience, have you done any research on this? If so, can you share this with us?
Yes, I did do research on this cause of death certification. I did had an opportunity to examine nearly around 890 cause of death certificates from different hospitals of a region. And it will be very disappointing to reveal the outcome of that particular research, and I did publish those research articles in an international journal. And in this, the results of those research is 98% of the cause of death certificates were inappropriate, they were misleading, and the information was totally inadequate, and they were not complying with those standards prescribed by the WHO, because the terminologies which were used were never matching with the ICD-10 classification of diseases. See, all those diseases terminologies which we enter in the cause of death certification should be those terminologies which should match with the ICD-10 classification of diseases or the morbid conditions. So any discrepancies will lead to a wrong statistics, that means wrong interpretation, that means to say wrong health policies and wrong health programs. So that is the reason we should understand that the terminologies should be used as per the ICD-10 classifications. But what I observed in majority, that is 98% of the certificates, is that the underlying causes were non-existing, nearly 60% of the certificates, and it was only the immediate causes are mentioned, and those immediate causes of death were either the mode of death or the mechanism of death, but not the cause of death. See, majority of the certificate what we saw was respiratory failure, asphyxia, coma, asthenia. These are the things which we saw. They were nothing but the mode of death or the mechanism of death, but they were never the causes of death. But these were the terminologies which were mentioned in 98% of the certificates. So overall, I would like to say that there are huge flaws being identified, and these certificates were misleading the government, and it is very surprising to note that the policies derived out of those certificates will definitely be having a disastrous consequences on the health programs and the implementation of those programs in the nation. So I have certain recommendations to the government based on this particular research and my observations and experience. I would like to recommend the government that the government should consider that the doctor who does the error or wrongly certify a cause of death, or put a misleading information in the cause of death, that should amount to a professional misconduct or an ethical negligence, and it should be penalized accordingly. That is one recommendations which I have to the government. And the second recommendations which I would like to give to the government is, the government should have a supervisory body at each district level. All the doctors who certify the cause of death certificate need to submit to that supervisory body appointed by the government within 72 hours after the death of an individual. And the supervisory body should study each of those certificates issued by the doctor, and if the certificate is not complying with the ICD-10 classification of diseases and the WHO standards, that need to be returned back to the author of the certificate, and unless rectified, it should not be accepted by the supervisory body. It is the supervisory body should be responsible for the collection of those cause of death certificate, and that should be based on that particular supervisory body documentation. The health policies or health program should be framed of a state, from a state or a nation. Thank you.
Thank you, Dr. Rao. I hope now we all have understood the cause of death certificate and its importance. I also hope this chat with Dr. Rao has given a whole insight into the process of cause of death certification. I will soon meet you all with information on other subject matter in the coming week. Till then, goodbye. Thanks for watching FINA YouTube channel. Please share this video and subscribe.